The nasal cavities are hollow spaces within our head that are lined by mucosa, or mucous membranes. And these cavities are going to be subdivided by the nasal septum. So they're going to be positioned to either side of this midline structure. The boundaries of the nasal cavity are going to be the two apertures, one on the outside near our face and the other one on the inside of our head. So this is going to be a fairly deep region that is going to extend from the tip of our nose to the back of our throat. The openings on the outside are known as external nasal apertures. We would have a nostril to the right or the left sides of that nasal septum. Similarly, on the inside, we're going to have an internal nasal aperture to either side of the septum. So now we can have air flow from the external environment up into this mucus-lined cavity, where the air can be warmed up, humidified, and even filtered with the hairs within this area. It's also going to be the route for the air to bring in the chemicals that we pick up and detect with our sense of smell. So those nerves are going to be in the nasal mucosa that lines this cavity superiorly in the region of the middle of our head. Now that nasal mucosa is also going to be in open communication with the air sinus cavities within our head, which are going to help lighten the skull and allow for resonation of sound, and also assist with the humidifying of that air before it reaches our lungs. So let's first take a closer look at some of the other boundaries of this space in addition to the external and internal nasal apertures. Superiorly, the ethmoid bone is going to form the roof as well as aspects of the nasal septum from its perpendicular plate and the lateral wall of the nasal cavity. It's also going to form part of the medial wall of the orbit like we can see here. So this small irregular shaped bone is positioned within the midline of our head, and it's going to have openings to allow for those olfactory nerves to descend down into the superior aspect of the nasal mucosa. Inferiorly, we're going to have the boundary formed by the hard palate, which is going to have two different components. An extension of bone as part of the maxilla known as the palatine process, as well as the horizontal aspects of the palatine bones themselves. So we're going to have hard boundaries inferiorly, as well as laterally and superiorly, but then cartilaginous and soft tissue boundaries anteriorly and an opening posteriorly through the two nasal apertures. Posteriorly, the nasal cavity is going to open up into the region of our throat known as the pharynx, and the superior-most part of the pharynx is called the nasopharynx, which is in direct communication with the oropharynx more inferiorly. So the oropharynx is going to differ from the nasopharynx in that both food and liquids and air will come through the oral cavity. However, traditionally, only air is going to pass through the nasal cavity. Now, you may have seen somebody laugh while they're drinking milk, for example. And what can happen, because this is an open communication, is that can allow for an exit or communication into the nasal cavity. So they laugh really hard and the milk comes out their nose because this is a hollow cavity. Now, some of the different structures that form the shape of this space are the nasal concha, and those are going to be curved bones that extend from the lateral wall into this space. They're going to then be lined by mucosa and create small pockets known as a meatus, which is where we are going to have drainage of the various nasal sinuses. For example, we are going to have the frontal sinus drain from a superior perspective in our forehead down into the middle meatus. We're also going to have the nasolacrimal duct from our eye, which drains our tears below the inferior meatus. And lastly, we can see the large maxillary sinus would be in open communication with the middle meatus as well. Drainage